Hi, my name is Dr. Brad Anderson. I am a gastroenterologist in practice in Columbia, Missouri. It's my pleasure to get to share with you a little bit about my experience with mcompass, which is an anorectal manometry platform offered by Medspira. To frame our conversation, I'd like to just give you a brief background about myself before talking about what is anorectal manometry, why does it matter to you and your patients. We'll talk about some of the things that you can expect with integration of mcompass into your clinic before talking about some of the potential physician benefits, patient benefits, financial and practice growth opportunities, and then we'll conclude with a brief summary. So again, my name is Dr. Brad Anderson. I'm a gastroenterologist. My journey into motility diagnostics began during my advanced motility training at Mayo Clinic. I was fortunate enough to be able to train under some of the best mentors, some of the most knowledgeable people about anorectal disorders. And one of my mentors was critical in the development of mcompass. So I had very early exposure to the technology. When I came out into practice myself, I was looking for what type of platform I wanted to use, and this was an obvious candidate given that type of exposure that I had in the past. Coming to my practice that I'm at now, I'm one of 7 providers. They did not have anorectal manometry before I joined, and in this area, this type of offering was few and far between. So there was certainly a great opportunity to implement this type of platform or testing. So a little bit about my clinical and patient practice with mcompass. We implemented the technology in 2022, so we're just at about the 3-year mark. In the lifetime of our anorectal manometry program, 83% of our patients have been female, 17% have been male. Our mean age of patient has been 52, but that's ranged between 18 and 88 years of age. We have kept our anorectal manometry testing open. So just like with a colonoscopy or with an upper endoscopy, an outside provider, if they feel that this type of testing is warranted, they can directly refer a patient over for this testing. They do not need to be seen preliminarily by me or one of my colleagues in clinic. We have one nurse who's assigned to conduct our anorectal manometries each day, and so that just kind of keeps things flowing and clean. And then once those results are interpreted, the results are then sent to the ordering provider for their review, and that provider then is responsible for follow-up and management moving forward, unless they specifically ask us to stay involved. So what is anorectal manometry? Why is this something that's important? So as far as the second part to that question, it's a diagnostic tool used to evaluate pelvic floor and anorectal disorders. And so we have recognized more and more as time has gone on just how important an assessment of the pelvic floor is to determine the underlying causes for things like constipation, pelvic floor dyssynergia, fecal incontinence. There can be elements that contribute to previous diagnoses of irritable bowel syndrome or IBS that can go uncovered unless anorectal manometry is used, anal sphincter dysfunction, and then there's a number of other anorectal disorders that this type of testing helps to evaluate. There are differences as far as the types of anorectal manometry programs. So there's something called traditional anorectal manometry, which mcompass is one example. It's a low initial investment, usually a very simple setup. The exams are very efficient, generally 15 minutes or less, and that means a very high increased or high patient throughput. The catheters are disposable, so very simple upkeep. And in comparison, something like high resolution anorectal manometry, that's often going to be employed if there's a higher level or higher need for an accurate diagnosis. We typically see these more in tertiary or quaternary referral centers, but they have a higher cost of investment. Usually those balloons are going to be manually affixed to the catheter, which then is going to require some cleaning as opposed to, in general, them being disposable. And then because of the amount of time that's going to be needed for high resolution anorectal manometry, generally there's going to be less patient throughput with using this type of technology. So as far as integration of the mcompass device into my clinic, could not have been easier. We started with an educational meeting with really all of our stakeholders. So the providers who would be referring, as well as myself, our nurses who would be conducting the test. And really what we wanted to do was identify what were some of the indications and contraindications to that test, first and foremost, who and who would not benefit from testing. As far as those referrals then that we get from other offices, we were able to educate an intake specialist as well as a scheduler to be able to inform those patients when they're being referred as far as what type of preparation is going to be needed ahead of that test, what they can expect on the day that the testing is performed, just to demystify the process as much as possible before the actual day of the testing. And then the nurse who conducts the actual test themselves, it's just going to be one nurse per day. We found that to be a nice balance as far as the clinical duties that they had outside of using the mCompass device and providing this type of service for our patient. So one staff member does the testing, one patient per day is what we've limited it to. And that, again, is going to really minimize the amount of interruption that we have to other daily operations. So as with anything, when you're trying to determine whether you're going to implement something into your clinic, it takes a decision-making process. We wanted to be as comprehensive as we could in evaluating mCompass and other systems. Yes, I'll freely admit that, financial efficacy was going to be something that's important, but I also wanted to make sure that the data that we gleaned from our testing was going to be top-notch. And so review of what clinical data was generated was certainly attractive with mCompass. We wanted to make sure that there was an appropriate infrastructure, that if we needed troubleshooting or we needed supplies, that the company that we chose was going to be able to follow through. And again, MedSpira was able to give us those assurances, which they have been able to maintain and come through with extremely well since we've adopted the test. And then I've had a colleague at an outside academic institution who had successfully integrated mCompass into his own practice, provided me with a strong endorsement, and then that just validated my interest in using this system moving forward. So as far as physician benefits, again, when we're seeing a patient where we're concerned that there might be an underlying anorectal disorder, we want to make sure that we have the confidence to tell somebody that the test that they've had is highly accurate, highly sensitive, and specific. So as far as the accuracy with mCompass, the balloons are designed to be precise. They give a 360-degree anal reading with 4 different balloons. The patient compliance is very high because this is a very well-tolerated examination. It's a nice flexible catheter. Pain is generally not an issue with this, but we'll always coach a patient through the testing as we're conducting it. The testing itself is pretty streamlined. There's very few connections that are going to be required. It's just a tabletop device that's used. The catheters are disposable, which is a huge plus as far as just maintenance. And then the results, I'll say as the person reading it for our group, very easy to interpret, easy to read. It takes me not but just a few minutes in order to generate that report and get it to the referring provider. So a little bit about the workflow advantages with this type of platform. Again, very easy to use. Our nurses have really never had an issue with it. Quick and reliable results, we mentioned that already. Those results are just put on a little USB. That's provided to me at the end of the day. I'm able, at my convenience, to access those data and then generate a report from the data that are generated. Few connections, again, not a bunch of wires. It's very easy just to have in a room. You don't have to have a dedicated procedure room, although we have elected to do so just so we have all the accoutrements needed to complete the testing. As I mentioned, these exams can be done in as little as 15 minutes, and the more practice you get with this and the more practice your support staff has, the more efficient you can be. But really, the equipment is extremely friendly. Doesn't necessarily matter their clinical background. It's something that's pretty intuitive and easy to get into. And no calibration is required with this test as well, which again, just as far as maintenance, helps you keep up and going through the lifetime of using the platform. So a little bit about the patient benefits. We mentioned that, again, this is a shorter test. Patients are certainly going to appreciate that. They want to be able to come in, get their test done, leave, and do what the rest of their day has in store. The way that the catheter is designed is so that comfort is in mind. Certainly, we have very few patients who describe to us that they felt uncomfortable during the examination itself, and we've done hundreds of those tests at this point. The results are very clear. It's easy to give patients an idea about what steps are going to be required once we have that testing completed. Again, fast diagnosis. If somebody's coming in for a test, I want to know and be able to give those patients results, and we get those fairly instantaneously with this platform. The treatment then, once we have an idea of what direction we're going, we can make the referrals that we need to, or we can implement additional testing if those results require that that's the direction that we head. The results are going to be accurate, so I have the confidence as an ordering provider in telling patients, this is what we see and this is what we need to do. And ultimately, if we can be efficient, streamlined at getting somebody from referral to diagnosis and then ultimately treatment, it helps to improve their quality of life. As a real world example, again, I have a large number of patients with chronic motility disorders. Chronic constipation is above and beyond the most common thing that I'll typically see in clinic. I've had one patient that's followed with me for the past year. She had seen multiple providers over the course of almost a decade before seeing me in clinic. Really, the treatment for her constipation had centered on various pharmacologic methods. She'd had some success, mostly though was left with kind of a dissatisfied feeling. Always felt like she had to rely on medications as her way of coping, with her constipation symptoms. We were able to discuss a little bit about the principles of pelvic floor dysfunction. This was a new concept to her. And once we were able to perform the anorectal manometry testing that verified indeed she did have an element of pelvic floor dysfunction, we were able to connect her with a local physical therapist with a specialty in pelvic floor retraining and biofeedback. And that's been an incredibly impactful experience that she's had. I've had several follow-ups since. She has a very close relationship with that provider and is grateful for the information that they provide her. And really, she's much less dependent upon medications. Occasionally, she may need something to kind of help inspire a bowel movement, particularly on vacations. But above and beyond, tells me that her life is greatly improved because we were able to identify something that other folks had not previously identified and offer her a treatment that was not going to require another medication. So a little bit about the financial impact. Again, not the most important thing to us as physicians. That's going to be the health and well-being of our patients, but is certainly a consideration when you're thinking about offering a new ancillary test in your clinic. So to open our own books, generally we've experienced an $85,000 annual revenue. That's just doing one case per day. Our personal mix is about 50% governmental payer, 50% commercial, and we've averaged 155 encounters per year. That boils down to approximately $550 on average per case revenue. Our growth chart here, you can see from 2022 when we started through 2024, our revenue has remained fairly steady over those 3 years, and you can see that our volume has remained steady as well. There are opportunities for further growth in the future. For us in particular, if we ever wanted to expand beyond just the one test per day, that's something that we could certainly do. The queue would support that at this time as well from the external referrals that we see. But again, your mix of patients that you see, your own clinical practice and habits is going to warrant or dictate what type of volume that you're going to see in your particular clinic. But I want to be able to enforce that we've been able to see some good financial impact even with just doing one case per day. In summary, mCompass by Medspira is going to provide better patient outcomes through enhanced diagnostic and treatment options. There is a potential for high clinical financial impact as well as growth impact. This is a very easy product to use, and your staff will endorse that from day one. The procedures are very quick. The patient compliance is going to be very high because of how easy, simple, and relatively smooth the procedure goes. We look forward to potentially working with you. Please contact Medspira at the phone number that's listed there, or email their sales force if you have questions or concerns. Thank you for the opportunity to share my experience with you.